any number of courses introducing therapists to various forms of sand tray, sand therapy, sand play. Learning about sand is lifelong learning. There's no possibility of skipping some of these primary concerns, ethics, culture, competencies that are different with different populations. And so we're all in lifelong learning. I continue to learn over many decades and will continue. So it's not set up that this is what it's not. It is not an introduction to here are some things to purchase. Here's a prompt for you to use. This course, Competencies Level 1, goes into depth and explains the not only the overall framework, but also what are the components that lead to proficiency. How do I, as a therapist, become competent? What does competency even mean? What is that composed of? Until we unpack something, we don't know what it's composed of. It just becomes a technique. And we're throwing people into the forest and saying, here's a shovel. What do I do with it? So that's level 1 is covering the topics to make sure that we have a foundation before we move on.
And then there are 3 levels, right? So
yes.
Level 2, can you say briefly what each of the other 2 levels as well are covering?
Level 2 is taking the knowledge, that real foundation from level 1, and applying it to cases. Your case, your case, your case, and your case. So it is looking at ways of understanding and responding, but with various cases, so that we look at, well, what does it mean when you have a couple, or when you have a parent and child, or when you have you're struggling with some autism for one population, and for somebody else it might be eating disorders. How do we apply this? If there's a psychiatric diagnosis, or if you're in a limited setting where you have to carry, like in a school setting or in a hospital setting or hospice. So level 2 is hands-on application through video, through discussion, through visual aids that will show, here's a sand scene, here's the case, what are you noticing? How would you respond to this? What does this bring up for you? What are the emotions? And what are your presuppositions as you look at this scene? How old would you suppose this was? And if this same scene was done by a 5-year-old, 25-year-old, and a 55-year-old, what would be the difference? Is it masculine or feminine? What is the difference? So case consultation really anchors it.
So then level 2 is sort of a broadening of it's a ground. It's amplifying the ground that's been set by level 1 and really looking at it in a much broader perspective.
Illustrating it, demonstrating it. Yes.
So more of a practical,
bringing it alive.
Direct application.
Yes.
And then level 3, does that get more into an immersive sort of personal application in addition to the others? Or
so now the thread, like the roots of a tree that are sucking the nourishment, the water from the ground. So level 1 is that rich soil and the moisture from the rain, and it's coming up through the trunk in level 2, and then in level 3 it's bursting out. So it comes full circle with who are you? What are your limitations? What kind of feedback do you need? How are you getting immersed in this experience in your community or through conferences, through your own clinic colleagues? So it is definitely watching and attending to levels of types of work through video, but also a reflective journal. And I'm talking about in-depth. How do we unpack a sand scene? This is where I train therapists to take these some figures in a sand scene that they create or their client, and now unpack them. What are the cultural meanings? What are the familial meanings? What are the personal meanings? What are the developmental? We look at all of our rich developmental theories, so that any therapist should be able in level 3 to take a different theoretical perspective, to understand the developmental implications, to unpack symbol meanings for possibilities, and be very mindful of their projections, as well as journal in depth by writing their own story. their own unpacking, their own sand scene. Sand therapy competencies emerged out of my own research for decades. Not only my doctoral research, which is a cross-cultural study in sand and unpacking a Jungian analytical approach to bring a non-Western perspective, indigenous perspective, but also decades of doing case consultation, attending to therapists who use sand, teaching it in workshops. So my own background is really humanistic and existential training. And my doctoral research really brought in the analytic as well as the indigenous studies. So an anthropological fieldwork perspective was important.
So you're coming at this not only from the training and the sort of European traditions or ideals, constructs, but you've also approached it from a cultural critique, really,
Yes.
of that,
Yes.
seeing it from the outside.
Yes. So my doctoral committee was brilliant. Berkeley, Stanford professors who taught at Saybrook, and then the look at sand was to be really an unpacking of the biases that we bring when we take on Western European theoretical orientations, such as Jungian. So I loved Jungian psychology. I loved that approach, and I had learned that. But now my job as a doctoral student was to understand it from another point of view, not from another Western theoretical point of view. Not that's apples and apples, but to stretch beyond what are other people's when we come from a different culture. If it's an indigenous worldview, what are their myths, their symbols and rituals, unique meaning for them that have oral tradition passed down from generation to generation? How would they experience? Because really, I want to emphasize that at some point, show the importance of our capacity to show images on cave walls 30,000 years ago is present within us today, and we do it this time in a sand scene. And so our capacity to use projection, our brain's capacity, our eyes' capacity to take what's embedded in our body, Candace Pert's work, the emotions of the body, and Stephen Levine. So to take those and to understand that all the work in the sand is a projection of these stories, these emotions, these images, unknown and known. And my dedication then is to support and teach therapists how to conceptualize, how to understand, and how to respectfully respond to this many, many layered aspects of sand therapy. I love this so much. This is my life work. This isn't something I do on the side. This is something I've been doing for decades. I love what I do, and I love the people who are so dedicated on the front lines working with clients. So my goodness, why come here? Because of the depth that I feel I can offer, because of the academic skills that I bring. I bring high level of critical thinking and rigor. I expect rigor of my graduate students as well as my clinicians. And I want them to go away feeling very fulfilled. I